In that session, we are going to describe the boundaries and the contents of the infratemporal fossa. So we are going to describe that fossa, the infratemporal fossa, starting by the boundaries. That is the area here, which you call it the infratemporal fossa. It lies medial to the ramus of the mandible. That is the ramus of the mandible, which have been removed to expose that fossa. That is the temporal fossa here on the lateral side of the head. So the boundaries are: the roof is formed by the infratemporal surface of the temporal bone and the greater wing of the sphenoid. It is opened superiorly, as we said here, with the temporal fossa. The medial wall is formed by the lateral trigoid plate, where the wall of the pharynx and the tensor and elevator palati will be also on the medial side. The lateral wall is formed by the medial surface of the ramus of the mandible. The contents of that fossa are the lateral trigoid, the medial trigoid, the tensor palati, and the elevator palati muscles. The main content is the mandibular nerve. The maxillary nerve will just passing by as it leaves the skull through the foramen rotundum to the infratemporal fossa here, make a loop to go directly to the trigopalatine fossa. The otic ganglia, which is suspended from or to the mandibular nerve, the maxillary vessels, the artery and the vein, the trigoid plexus of veins, a very important plexus of veins is found in that fossa. As we have seen in the face, it is a site of communication between the veins of the face, veins of the pharynx, of the larynx, of the nose, with the cavernous sinus. The muscles which we are going to describe are the muscles of mastication. Two of them are found in the infratemporal fossa. Let's start by the temporalis, which is outside the fossa. It's only very small part which will be found of its tendon. The origin of that muscle from the temporal fossa up to the superior temporal line on the skull, the deep surface of the temporal fascia, this fascia here, which is a very strong fascia covering the muscle. Insertion will be after it passes deep to the zygomatic arch, which is broken here, that's part of it, to be attached to the medial surface of the apex, anterior and posterior borders of the coronoid process, the anterior border of the ramus of the mandible down to the last molar tooth. The action of that muscle as a part of the mastication, elevation of the mandible, posterior fibers will retract the protruded. The second muscle is the Bacita muscle, which is found also outside the fossa. That muscle here, which we have found on the outer surface, taking origin from the lower border and inner surface of the zygomatic arch. That's its origin. Its insertion, the fibers of that muscle are divided into superficial, middle, and deep fibers to be inserted into the outer surface of the ramus of the mandible. The action of that muscle is mainly to elevate the mandible, and with the other muscles, it can protrude the mandible. The medial trigoid muscle, the one which is directed toward the angle of the mandible here, that muscle takes origin by two heads, a superficial and deep heads. Superficial and deep to the lower head of the lateral trigoid. That is the name given, superficial and deep. The superficial one from the maxillary tubercle, which is found just posterior to the last molar tooth. The deep head comes from the medial surface of the lateral trigoid plate. The insertion of that muscle in the medial surface of the ramus of the mandible, just above the angle of the mandible. the action, elevation of the mandible. With the lateral trigoid, it protrudes the mandible, and the gliding of the mandible is done by these two muscles. The lateral trigoid, which is the second muscle found inside the fossa with the medial trigoid, the origin is by two heads, an upper head from the infratemporal surface of the and infratemporal crest of the greater ring of the sphenoid, the lower head, which takes origin from the lateral surface of the lateral trigoid, having superficial to it the superficial head and deep to it the deep head of the medial trigoid. The insertion of the lateral trigoid in three parts. In the trigoid fovea on the neck of the mandible, that is the lateral trigoid here, to the trigoid fovea, the articular capsule of the temporomandibular joint, and the disc of the temporomandibular joint, which you can see it over here inside the joint itself. This is the insertion of the lateral trigoid. The action of the lateral trigoid is to open the mouth. It does not elevate the mandible and the others. With the medial trigoid of the other side, move the mandible from side to side in the shearing. With the medial trigoid of the opposite side, both protrude the mandible. That is the lateral trigoid muscle. Now, let us explore the contents of the infratemporal fossa through these two cadaveric specimens. The one which is a bit more deep to the other, that is the one which is deep, and that is the one that's more superficial. What we can see here is the lateral head of the lateral trigoid, that is the lower head of the lateral trigoid, where the maxillary artery or that head divides the maxillary artery into three parts. It either passes superficial or deep to the lower head of lateral trigoid. That is the maxillary artery here and the maxillary artery over here. So that is the maxillary artery on this side, and that is the maxillary artery on this side. The medial trigoid here, and that is the mandibular nerve, the main trunk of the mandibular nerve as it leaves the cranial cavity through the foramen ovale, then give its branches. That is one of the largest branches of this mandibular, the lingual nerve here and here. Then the inferior alveolar, the second large, this one here, and here in the mandibular canal, also here in the mandibular canal, that is the inferior alveolar nerve here. And then the inferior alveolar artery, which join the branch of the maxillary, which will join the nerve in the canal. That is the auriculotemporal nerve, which is a branch of the mandibular going to supply the scalp. That is the buccal nerve over here, which is a sensory branch of the mandibular nerve supply the skin over the cheek. That is the one here, and that is the one on the other side here. That is the buccal nerve. That is the buccinator muscle here. That is the part of the buccinator. The superficial temporal artery, one of the two 10 branches of the external carotid, can be seen here. The middle meningeal artery, branch of the maxillary artery as it goes to the foramen spinosum. This is the middle meningeal artery. The deep temporal artery, this one here, and this large branch over here. The deep temporal nerve just lateral to it, that is the deep temporal nerve. The digastric, the posterior bill of the digastric can be seen here. The maxillary artery, which is the main part of the fossa, is seen here. And what we can see here is the maxillary artery, which we are going to describe that artery. That is the external carotid, where it divides into maxillary and superficial temporal. So that is the external carotid, that is the maxillary, that is the medial trigoid, as we have seen it before, that is the mandibular nerve. Now, again, that is the maxillary, which is the largest terminal branch of the external carotid. It arises behind the neck of the mandible, actually midway between the neck of the mandible and the mastoid process. That's where the external carotid will be terminating within the substance of the aortic gland. It is described as having three parts: a mandibular part, a trigoid part in relation to the trigoid muscle, and trigopalatine part within the trigopalatine fossa. The mandibular part, which runs horizontally, as we said, from the midpoint between the neck of the mandible and the mastoid process horizontally by the medial surface of the ramus, pass between the neck of the mandible and the sphenomandibular ligament below the auriculotemporal nerve. So it passes between the neck of the mandible and that ligament just below that nerve. Then next it crosses the inferior alveolar nerve and skirts the lower border of the lateral trigoid, reach the lower border of the lateral trigoid. That is the maxillary artery again. The trigoid part ascends obliquely, as you can see here. That is the trigoid part here. Ascends obliquely and in 6% of cases superficial to the lower head of the lateral trigoid, which we have seen it. This is the lower head here. So either superficial in 6% or in 40% it is deep to it. When it runs deep to the lateral trigoid, deep to that head, it lies between the muscle and the branches of the mandibular nerve, which is almost all the time deep to the lateral trigoid. So either superficial or deep to the lower head of lateral trigoid. When it is deep to the lower head, it is anterior to the mandibular nerve and its branches. Where the maxillary artery runs superficial to the lower head of lateral trigoid, the artery passes lateral to the inferior alveolar, lingual, and buccal nerves. It is lateral, crossing those nerves, which are the inferior alveolar, the lingual, and the buccal, lateral or superficial to them. The trigopalatine part will pass between the two heads of the lateral trigoid to reach the trigopalatine or trigomaxillary fissure first, before it passes into the trigopalatine fossa, where it terminates at the third part of the maxillary artery. That is the course and relations of the maxillary artery. Let's have the branches of this artery. From the first part, it gave named branches, 5 of them: deep auricular to the ear, anterior tympanic to the tympanic cavity, apical meningeal to the cranial cavity, the dura, accessory meningeal again goes to the cranial cavity to supply the dura, and lastly the inferior alveolar, the largest branch of it, which enter the mandibular canal to supply the teeth of the lower jaw. The second part is almost all of it is muscular branches, which are the trigoid branches to the trigoid muscles, masseteric branches to the masseter. It passes in the mandibular notch between the head and neck, or the condylar process and the choroid process. The deep temporal to the temporalis muscle, the buccal to the buccinator. The third part is branches, corresponds to those branches of the maxillary nerve and the sphenopalatine ganglion. So it gives the posterior superior alveolar, which supply the upper jaw, infraorbital, which comes through the face to supply again the upper jaw and the face, the greater palatine, which will supply, as we have seen it, in the palate and reach the nose, the sphenopalatine, which will supply the nasal cavity, the pharyngeal branches to the pharynx, the artery of the trigoid canal. If you remember, it would go to the trigopalatine fossa, the descending palatine again to the palate. So this is the branches. Now we are going to describe that very important plexus, the trigoid plexus veins, which we have come across that plexus during study of the face. the scalp, the nose, the pharynx, and also the cranial cavity. That plexus, which is found in the infratemporal fossa, is connected by large veins. And this connection with large veins here, and then got connected mainly to the sinuses of the dura mater in the cranial cavity, mainly the cavernous sinus. What you can see is the superficial temporal vein here, which drains the scalp, is connected to that plexus. The maxillary vein, which come out from that plexus to unite with this superficial temporal, forming the retromandibular vein. The anterior facial vein, which drain the face and connected to that plexus to the cranial cavity. That is the pterygoid plexus of veins which we are talking about. It's very important in communication of the outside of the skull, many parts, as we said, the nasal cavity, the pharyngeal cavity, the mouth cavity, the teeth, of course, the face and the scalp. All of these are connected with the dural sinuses, especially the cavernous sinus. That's all about the infratemporal fossa. Thank you.